Hi, my presentation is titled Investigating Cancer Clusters. So a little bit about me. My name is Sophia Huang, and I'm a recent graduate of Mount High School in Arden Hills, Minnesota. I'm also an incoming freshman at Brown University. My hometown is St. Paul, Minnesota, and some activities I'm involved in include STEM research, the Stanford China Scholars Program, being a cartoonist at the Sierra Project Foundation, where I create health youth comics, and being a three-time All-State violist. And my interests lie in epidemiology, health policy, and international relations. So cancer is the second leading cause of death worldwide, and according to the CDC, a cancer cluster is defined as a greater than expected number of cancer cases that occurs within a group of people in a defined geographic area over a specific period of time. And cancer clusters have been reported worldwide in countries such as the US, Canada, England, and China. It is often difficult to prove that a cancer cluster exists because first, cancer is common, and so it is not unlikely for multiple people in a small area to develop cancer at the same time. Second, unusual patterns of cancer prevalence could occur by chance. And third, as seen in the previous slide, there's a strict set of criteria that must be met in order for a cancer cluster to be identified. So even if a cancer cluster is proven to exist after investigation by a state or federal health department, it is rare for a cause to be identified. First, especially in cases where there are multiple exposures to cancer in a geographic area, it is very difficult to single out one specific exposure that directly causes a cancer because in many cases, exposures intermingle. And second, there is a latency period between exposure and cancer that differs in situation to situation. So it is difficult to prove the direct relationship between an exposure and, let's say, the formation of cancer in 2 or more years. So for this presentation, I will be looking at China's cancer villages as a case example. Is because it is one of the most high-profile cases of cancer clusters on the nationwide level. And in the 2000s and early 2010s, this was highly covered on international media. So what are cancer villages? They're rural villages that are typically surrounded by chemical plants or coal-fired power plants. And in these small communities, rates of cancer are at least twice that of China's cancer death rate. So when did this begin? Reports of cancer villages began as far back as the early 2000s, and the phenomenon of cancer villages was first acknowledged by the Chinese government in 2013, which is over a decade later. How many cancer villages exist in China? While the exact number is not known, Chinese media experts and NGOs estimate that there are 459 cancer villages across the country in every province except for Qinghai and the Tibet Autonomous Region. So there are three key contributors to the development of cancer villages. First is environmental pollution. Second is disparities in accessing and affording health resources. And third is unaffordable medical treatment. So the first cause is environmental pollution, and in this case, I'll be specifically looking at water pollution. Industrialization and unprecedented economic growth in China have pulled millions out of poverty, but at the cost of the environment. According to government reports, over 70% of rivers and lakes in China are polluted, and more than half of water resources are not suitable for human use. Historically, there was little infrastructure in place for water and sanitation services in rural regions of China. Although more infrastructure for water services was built in rural areas starting in the late 1980s through China's Patriotic Health Campaign, nearly 100 million people in China rely on hazardous natural sources of drinking water, which contain industrial waste with carcinogens, and when ingested, one has a higher chance of developing cancer. The second factor is disparities in health resources. So in order to understand China's healthcare system, I need to explain the incredibly intertwined hukou system. So the hukou, or household registration system, was created in 1955 to exclude the rural population from accessing state-allocated welfare and entitlements. An individual's hukou status was determined by where they were born and their lineage. This system granted better education, job opportunities, housing, health insurance, and other social services to urban hukou holders. In the past 2 decades, the Chinese government has made efforts to improve healthcare nationwide, and I'll be focusing on health insurance specifically. So in 2000, around 20% of Chinese citizens had healthcare coverage, and only 1 decade later, nearly 95% of the population was covered, and that's more than 1.35 billion people. So state-owned healthcare plans are based on an individual's hukou status and employment, and there are two plans. One is for employed workers with an urban hukou status, and the second plan is for unemployed citizens with urban hukou status and rural residents. It was found that unemployed urban residents and rural residents receive health insurance benefits worth at least 5 times less than that of employed urban residents. The third factor is unaffordable medical treatment. So standard cancer treatment is costly due to 3 main factors. So first, drug research, development, and approval is a timely and expensive process, and this forces pharmaceutical companies to hike up their prices for their drugs in the market. Second, most health insurance plans don't cover all cancer drug types. And third, many developing countries rely heavily on costly imported drugs from foreign pharmaceutical companies because they currently do not have enough resources to produce high-quality drugs to meet the nation's demand. So I believe that increased government attention in technological innovation could pose as solutions to cancer villages in China and cancer clusters across the world. So first, I believe that there should be greater transparency and accountability from the federal government to environmentally regulate manufacturing and industrial factories. Second, I believe there should be a greater emphasis on the preventative care model or public health model as opposed to the treatment-based model in healthcare systems. Third, I believe that technological innovation can be utilized to improve health literacy. Here are the references I utilized in this presentation. I'd like to thank Dr. Tanya Lee from the Stanford China Scholars Program for advising my independent research paper, An Invisible Cause: China's Cancer Villages. Thank you so much for listening, and here are ways you can contact me.